Dr. Natalie Marks, and we're here with a quick cup of knowledge. Today, I've got Dr. Brook Niemiec, who is the Chief of Staff at Southern California Veterinary Dental Specialty and Oral Surgeries. Thank you so much for joining us.
You're welcome. It's good to be here.
If people want to add dental radiography and they have an owner or a management team that's not maybe on the same page, what are some pieces of advice that you can give to some of these younger practitioners to help convince them that this is a piece of equipment you need?
Number one is if you're talking to an owner, if you're a young grad and you want your owner to buy it, there is simply not one piece of equipment that will make more money for a practice than dental radiology. And that's been proven over and over. Tony Woodward, who's a very dear friend of mine, who's also a dentist, he calls them ATMs because they just keep spitting money out. They just do. And so many times I've lectured all over the world, and people come back and say, we can't afford it. Our clients won't pay for it. Hear it every day. And I just was in New Orleans at our practice there doing our grand opening, and we had two different vets come in and said, you know what, I saw you lecture a couple years ago. There was no way I was buying dental radiograph. I was too old, nothing like that. She goes, it was the best investment I ever made. So when you talk to owners of clinics, it's money. It plain and simple is, and it's quality of care. You just can't do quality of care with dentistry. And then the last thing I would say on that part is that if you're really desperate, if you're a general practitioner, and trust me, when I graduated in 1994, I came out and my boss didn't have dental X-ray. Of course, no one did in '94. I walked out and said, "I won't work for you unless you have dental X-ray." He goes, "Okay, it'll be installed by the time you start." And that was 25 years ago almost. So those of you that are out there going, we don't need dental X-ray, dude, you're so wrong, it's ridiculous. When it comes to clients, and I'll also swap them to clients, again, it comes back to education. If you just say, yeah, we need to take dental X-rays, you're gonna get your A and B clients. Your clients that get it, they understand. Most clients are halfway intelligent, but a lot of them are gonna be like, oh, well, you don't need it. And I hear from vets, unfortunately, and this is another problem, where some vets will say we need it, some vets will say we don't. Pictures are worth 1,000 words. Clients are visual animals. If you have a tooth that's broken, or if you have something that you think is a tooth resorptive lesion, and you're like, we need to X-ray this, the client's will be like, well, you need to take it out. Well, especially when it comes to feline tooth resorption, there's two different types, and some you can craniotate and some you can't. So some kind of visual clue to a client, and through our telemedicine company, we do have importance of dental radiograph posters, and it's basically, here's the picture, this is what your dog's mouth looks like, here's the X-ray. I could break the jaw if I didn't know this. I could, leave a tooth in there. I mean, there's all these things that are valuable. You don't have to buy something, created. You can make your own up. Say, hey, Mrs. Jones, we saw a dog that looked just like your dog's. Look at the X-rays. And they'll go, oh, they have no idea. So that's the real thing. Education is the key for everybody. When you're talking to practice managers and owners, it's all about money. When you're talking to clients, it's all about quality of care.
Those are all great points. And on that note, you talked about all the things that we want to be saying to clients in the exam room. And being in general practice, we have 20 to 30 minutes at best, right, with that client.
Yeah. So how do I engage them? Well, there's two things. Empowering them is one. As doctors, as veterinarians, we need to do the diagnosis. We need to create the treatment plan. There's no reason that we need to discuss the treatment plan and why. So I actually created, I'm almost done with it, an online course called the Dental Concierge. So it's a way for paraprofessionals, for technicians, and that's the other thing I'll cite in here. In America at least, Canada is different, but in America, most veterinarians hate dentistry. Most technicians love dentistry. Who's going to do a better job selling dentistry? Someone that hates it or someone that loves it? So my recommendation to every practice would be to have one person that is the dental concierge, and they are well trained in anesthesia, pain management, what goes into a dentistry, why the X-rays are important, why extractions are hard, all these different reasons that dentistry is expensive and important, and then say, okay, Molly, go give them the broken tooth spiel. Go talk to them about perio. Mrs. Jones is afraid of anesthesia. Explain why ours is better. And also, why are we more expensive if you're good practice? So I am a huge believer in those people should be doing those things. And of course, here at the conference, there's tons of places that they can learn marketing, and there's technician track stuff as well. So the more information that the technician has, the more comfortable they are discussing, the better it's going to do. So yeah, I think that every practice should have somebody that can just go in there and talk dentistry.
And it sounds like that would also just improve the team approach, right? You're more invested in the case, you feel better about your job, and just improving work culture in general. And you make dentistry very exciting, because I'm one of those people that I really do like it. I'm not the best at it, and I'm certainly always learning, I think, like all of us. So what are some resources that you can recommend to them to get additional training or to feel more supported? You know, you mentioned I'm not going to work here unless you have, you know, these tools for me. What are some pieces of advice you can give to the graduating students?
Contact a local veterinary dentist. If you go to avdc.org, which is our website, you can find all the dentists around you. We take visitors all the time. I know the group in Phoenix does. I know that Dr. Bellows down in Florida does. I know that most of us will, because we're educators. So that would be number one. Number two would be the first thing that you graduate, you go in there and you're like, I need a dental hands-on course. And again, there are training centers all over the country. Okendo obviously is doing one. I'm already set up to do 3, March, May, and July at the Okendo Center.
It's wonderful. You're an invaluable resource and mentor, and we're very lucky to have you in the field, and gave a lot of great pearls to graduating students and practitioners like myself. So thank you so much for your time. Have a great rest of the conference.
Thank you very much.